Hi everyone, it is Dr. Prabakar and welcome to the Fibroid Doc. I decided to do a live this afternoon. Okay, I don't know what just happened. Um, okay, hi everybody, it's Dr. Prabakar and welcome to the Fibroid Doc. I had a little technical glitch there, sorry about that. I decided to do a short live this Sunday afternoon to answer a question that I have been seeing very often in clinic these days, and that is, should I take my cervix or leave my cervix during my hysterectomy? Um, so it's the end of the year. A lot of patients have met their deductibles, and a lot of people are now wanting their surgeries done before the end of the year. And so I'm actually doing quite a few hysterectomies. And so I wanted to address this question because I think it's an important one. So, a couple of quick points. About 600,000 women undergo a hysterectomy every year in the US. And by the time you reach 60, a third of women have already undergone this procedure. So a hysterectomy is a operation where we remove the uterus. Okay, but then what happens to the cervix? So the cervix is the portion that is attached to the uterus. It's right in between the uterus and the vaginal canal, and it's sort of the entrance to the uterus. So the question is, do you need to take that out or do you leave that? And a lot of patients struggle with this question. Um, so I just wanted to spend a few minutes to go over that. I wanted to give you sort of three things to think about in terms of, reasons why you would take your cervix out and three reasons why you would, maybe keep your cervix. Okay. And this is all informational purposes only. I'm not giving specific medical advice to any one person. Please use this information to then go and speak to your gynecologist if you are someone who's considering a hysterectomy and you've been thinking about these things. Okay. So, three reasons why you should take your cervix out. The first is if you are getting a hysterectomy for any sort of cancerous diagnosis. So, if you've been diagnosed with endometrial cancer or uterine cancer, cervical cancer, or ovarian cancer, part of the staging process is not just removing the uterus, but it is also removing the cervix. So, 100%, that's kind of a no brainer there. You should remove the cervix because there could be cancer cells left in the cervix. Um, and then there are a lot of patients who are getting a hysterectomy for um, fibroids. And in those patients, they clearly know why they're bleeding. And so they remove just the uterus. But sometimes patients are bleeding a lot and they don't really have a reason why. They don't have fibroids, they don't have polyps, they don't have cancer, but they're just, bleeding very heavily every single month. And they've tried all these treatments and now they are wanting a hysterectomy. Um, so for those patients, I do recommend removing the cervix because there could be some glands of the uterus that are hidden inside the cervix. And so you don't want to leave that and then, continue, even after you take out the uterus, continue bleeding from the cervix. And so that is a reason to also remove the cervix if you don't really have a good reason why you're bleeding. Because if you remove the uterus and there's some glands in your cervix, you could spot every single month when you ovulate, and you don't want that. Kind of the whole reason of doing this procedure for a patient like that is so they don't have periods or they don't bleed. So that's another reason you would remove the cervix. And then lastly, um, you don't ever need a PAP again, which is nice. A lot of patients find pap smears very traumatic, very uncomfortable, and if they're already in there, removing their uterus for whatever reason, they just want their cervix. They just want it out so they don't have to ever think about it. And certainly, if you've had, a history of HPV or abnormal pap smears, you should definitely consider removing your cervix at the same time as your uterus so that, you don't develop cervical cancer in the future. Okay. Now, top three reasons why you may want to leave your cervix is often the supracervical hysterectomy or just removing the uterus is a quicker operation and a less complicated one. So every time, anytime you do surgery, surgery has its risks, and your surgeon will explain all the benefits of the procedure as well as all the risks. And one of the risks of a hysterectomy are injury to nearby organs. There's the bowel, there's bladder right there, there's the ureters that go really close to the cervix. And so, if when you do a total, there is a slightly increased risk of complications. So that's one reason. If you're like, well, the cervix isn't really bothering me, I'm really doing the hysterectomy for fibroids. I just want the uterus out. Okay, I'm going to leave the cervix. So that's one reason you may want to leave it. The second is it is a quicker recovery. So if you're somebody who I have a lot of patients who are really counting the days they can take off of work, or they are not in a desk job. They're up and about doing physical labor. They really need to get back to work as soon as possible. So, those patients often just consider a supracervical hysterectomy instead of a total. So, they leave the cervix behind because the recovery is about 4 to 6 weeks versus, 6 to 8 weeks if you take out the cervix. Um, and then, lastly, a lot of patients really struggle with getting a hysterectomy because it is major surgery and they've spent a lot of time thinking about it. And they just want to take out, the minimal thing that's needed to help them live a life free of bleeding and pain. And oftentimes that is just the uterus, right? It could be because of fibroids, or they've got a bunch of polyps, or um, adenomyosis, or whatever the case is. They just want to take out the organ that is causing them the pain and the issues, and they don't want to remove anything else that is unnecessary. So if you're in that boat, then you may consider leaving your cervix. So hopefully that's been helpful to you. So again, the three top reasons why you'd want to take the cervix out, if you've had a diagnosis of cancer, if you've had abnormal paps in the past, or a history of HPV that has been recurrent, you um, don't want to ever spot again, and you just want to take care of the problem entirely. And then reasons you want to another reason is if you also don't have a clear reason why you're bleeding. So you don't have a diagnosis of fibroids or cancer or polyps, but you're still really bleeding and it's causing you a lot of issues. And then if you want to leave the cervix, considerations maybe because it is a quicker operation, a quicker recovery, um, and you've really been struggling about, whether you wanted the surgery in the first place or you just want to take care of what is actually really bothering you, and you don't want to take out anything that is not broken. So hopefully this has helped you think through things. One special mention I wanted to put out there is a lot of people ask, okay, what about sex? So is that going to be different if I take out my cervix versus leave my cervix? And studies have shown that there is no difference whether you leave your cervix or take out your cervix. And that's what I see in clinical practice as well. I've done a lot of supracervicals and a lot of total hysterectomies, and really, patients have not, come back and said, oh, now I have a problem or anything like that. So that should also put your mind at ease. So hopefully this has helped. I hope you can use this information as you decide whether you want to take your cervix out or leave it during your hysterectomy. And please speak to your surgeon about these considerations. Have a great weekend, everybody. And don't forget to tag somebody or share this with somebody who is thinking about this topic, is thinking about having a hysterectomy. And for more useful information like this, please follow me on Instagram and on YouTube at TheFibroidDoc. Thanks. Bye.